And welcome to the Dr. Bob Show. Does your stomach bother you? Does your stomach stay gassy? Does it cramp? Do you get nauseated? Do you not know what's going on? You've been to the doctor, you've tried some medications, they don't work? We'll be spending most of this show answering your questions about when the belly goes bad. My guest is Dr. John Altawil. Dr. Altawil is a board-certified gastroenterologist, stomach specialist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about what does a heart attack really feel like? And, Doc, I've got bad knees. What can I do about it? We're talking with Dr. John Altawil, board-certified gastroenterologist, stomach specialist. We're going to be talking about when the belly goes bad. John, welcome to the Dr. Bob Show.
Thank you, Dr. Bob.
If a person comes into you and they've been trying everything they can do to be healthy, and yet they're having stomach complaints, what do you do?
Well, it depends on what they have. Depends on the presenting symptoms. We have to talk into what they have experienced in the past, what's going on right now. We want to make sure they're safe.
So what if they've got gassy, crampy abdominal pain? What do you ask them?
So we ask them about their diet initially. What do they eat? What supplements do they take? What's their fiber intake? How they've been over the last 1 month? Do they have bloating in the morning, in the evening? Does it wake him up in the middle of the night and so forth? Then we talk about other symptoms, weight loss, abdominal pain, bleeding, and so forth. So we want to make sure they're safe before.
So you want to be sure and rule out by history if it sounds like it's something really bad or if it's something that's less bad.
Sure.
When somebody is giving you the stomach problems, or say my belly hurts, when somebody says belly hurts, what are you thinking of, John?
We think about could be ulcers, it could be a reflux, could be motility, could be movement of the intestines problems. People can be constipated, and that builds up gas, and they feel bloated. Could be bacterial overgrowth problems, and sometimes it could be bad things. So we gotta keep in mind everything possible.
What I'm hearing basically, if somebody has got a stomach that's bothering them, it may be simple, it may not be simple. So if somebody comes in and you take a history and the history sounds like it's nothing bad, where do you go?
So if they're young and healthy, then we usually try to go conservative. We do some recommendations about diet modification, ask them to get a better healthy lifestyle, look into their sleep pattern, their exercise pattern, and maybe try some simple remedies.
So does the simple things help people?
Absolutely.
So if they come back and say, I've been trying to be healthier and stuff, but I've still got problems, then do you have to, what kind of examination do you do?
So we do, initially for sure we've done a full body exam. We wanted to make sure everything is fine. Then we can do blood testing, x-rays, and sure, sometimes we do endoscopy. We do.
What would endoscopy be? What do you mean by that word?
So endoscopy would be a camera look inside their intestines. Sometimes we do it from the mouth, and sometimes we look, from
the rectum. A colon
yes.
exam.
We call it colonoscopy.
So everybody at what age, in general, without family histories, at what age should people start having a colonoscopy?
At the age of 50.
At the age of 50 in general. And if somebody has an EGD, what's it like? Does it bother the patient?
The procedure usually doesn't bother them. They're asleep. They get an IV. They get medications. Most of the time, it's a very short nap. It's about 5 minutes. They usually don't feel it. They wake up fast, and they carry on the rest of the day.
So when the patient wakes up and you say, hey, I look down your stomach, it just looks great, and we did a colonoscopy, and it just looks great, and they say, I've still got gassy, crampy abdominal pain. What do you think of? What do you do then?
So then I would say, let's talk about other possibilities. Let's talk into trying different remedies, and let's talk into your diet first. Let's say, what's your usual diet? What do you eat every day? And then we start to correct their diet habits.
So what are some of the bad things that people do in their diet that you say, you know, we really need to start off, is it better to skip a breakfast? Is that the best meal, most important? What do you do, lunch and supper?
So that's a great question. Breakfast is crucial. We always ask them to eat a protein-rich breakfast. It's very helpful. There's lots of growing evidence on this. Then I usually ask them to eat small, frequent meals throughout the day. And I usually recommend 5 to 6 meals.
So give me an example for breakfast, and then if you're going to eat 5 meals, you have to have another meal around 10 o'clock. What should a high-protein breakfast be, John?
So they can do 2 to 3 eggs with a little bit of oatmeal and maybe some healthy nuts like shredded almonds and stuff like that. That's a great breakfast.
So almonds and sometimes oatmeal and sometimes eggs. I'm hearing protein and fiber. Is that right? Is that important?
Absolutely.
So what do we do around 10 o'clock? I'm getting hungry again, but I had a lot of protein, so I don't get hungry too fast.
So that's a great time to take a little snack, or what we call it meal replacement. Yeah, so it could be a little bit of protein shake. It could be a couple pieces of a turkey. Could be
just anything with protein.
Sure.
Lunchtime, can we have a salad bar and put all the stuff on it, or is that the worst thing anybody could do?
No. We can't do that.
So give me an idea on lunch. What should we do again? If somebody is, it's 12 o'clock noon and they want something in their tummy, and nature tells them, I want something in my tummy. What do you recommend then?
So that's a great time to have another nice meal. Salads, green vegetables, steamed vegetables are great. Then a good piece of a good protein. We usually like to avoid red meats and processed meats a lot. So we ask them to do either chicken, fish, some soy-based protein. Sometimes we do seafood. Beans are good. So, but in moderation. I usually ask them to eat a small lunch.
Is that a key?
That's a key.
Moderation.
That's a key.
Do you need to sort of, how do you tell them moderation? You know, the plates are getting bigger. You go to a restaurant, they stack it high. So what do you tell somebody? What's a good portion, for instance, of beans and lettuce?
So there's a lot of tools to measure how much patients should eat. You know, you can measure on your fist, on the plate, a cup, and so forth. I usually ask them, what have you eaten before? Just eat half of that on that lunch.
It's a great thing. You don't have to concentrate so much on the fad diets, but you just cut down on what you're eating. So before supper, somewhere in the middle of the afternoon, and then supper, you sort of follow the same pattern. Give me an example of supper.
Before supper, I usually ask them to do like a Greek yogurt, or like a little bit of cottage cheese with fruits and vegetables. And that will be about 2.5 hours after the lunch, 2 hours before their supper, before their dinner.
You're really putting somebody on a good diet. Is that following a Mediterranean or a DASH diet, or that's just good eating?
There's a lot of diet being tried in the past. A Mediterranean diet, DASH diet, which is a diet aims to stop hypertension. Low-fat diet, low-carbohydrate diet, paleo diet, plant-based diets. All diets work, Dr. Bob. It's about how patients really follow diet and how willing they are to stick into it. That's the key.
John, are probiotics good for people? Do you recommend those in gastroenterology, probiotics?
Probiotics are great.
And that's what we're going to be talking about when we come back. Probiotics are great. What are probiotics? What kind should you get? What do they do to help you? So much more information. You're going to want to stay tuned. We're talking with Dr. John Altawil, board certified gastroenterologist. We've been talking about when the belly goes bad. We talked about eating properly, and really it means several meals during the day. 6 meals we can eat, but they've got to really be small. And that will start your GI tract getting back the way it is, where it can handle that small amounts. Is that pretty much right, John?
That's exactly right.
We talked about probiotics. We were going to mention it.
Sure.
What is a probiotic?
So probiotics, what we like to call them, the little buddies.
Little buddies?
Yeah, that's what we like to call them. They're live strains of bacteria and yeast that are good for the gut. Your GI tract will have about 400 different species of probiotics.
So there's going to be 400 in my GI tract. What do they do?
400 strains, there are about trillions and billions of bacteria.
Wow, wow. So there's lots and lots of bacteria. What's their purpose?
So we don't really understand how exactly they work. There's a lot of studies being done, a lot of, we're not sure, but so they help bring in the balance in your GI tract between the good bacteria and then the bad bacteria. So they do prevent the growth of the bad bacteria. Even if they grow, they prevent them from going throughout the tract, throughout the gut. They produce some signals. They bring the white cells into the gut. They try to get the white cells to fight them.
They're good
great.
guys.
They're great. And eventually, sometimes they help with pain control.
Help pain control too sometimes. So
Sure.
probiotics, is there a special one that you like? It was all right to mention a brand.
So the list keep growing up. I'm going to talk generic. We know there's a lot of strains of lactobacillus.
Uh-huh.
A lot of species of lactobacillus.
We see that sometimes on things that we buy at the store. It's got lactobacillus. Is that a good probiotic?
Lots of good probiotics come from lactobacillus, also from bifidobacterium.
Bifidobacterium?
And some good strains from E. coli. People hear about E. coli, they think they're all bad, but there's some good strains in E. coli, even Streptococcus. There's some good species of the Streptococcus.
Wow. So how do you know which ones to give? The doctor picks his favorite and they write that for the patient, or they can go to the pharmacist and get it? How do you know which probiotic?
So they can go to the pharmacist. There's a lot of over-the-counter formulas. I'll just throw a few, and not trying to suggest anything. Culturel, Align, Denactive, even Florastor. Florastor is an interesting one. It's a long one, Saccharomyces boulardii. It's a yeast. It's very helpful.
So you've got to get these names again from your doctor, from your pharmacist, and it frequently helps, sometimes always helps. Pain, gas, cramping, it sort of gets the GI tract going better again?
Sure.
So let's talk about diverticulitis, crampy, gassy pain. There's a difference in the two. What is diverticulitis, and what do you recommend for those people?
So diverticulitis is an inflammation, infection, irritation of the diverticulosis. So as we grow, some air pockets form in the lower GI tract and sometimes in the small intestines and upper GI tract, but mainly in the colon, mainly even in the left side of the colon. There are air pockets that pouch out of the colon. Sometimes people get issues with this. These get infected, they get inflamed, they get bacteria seeds inside them, they go bad, they cause a lot of pain, diarrhea, constipation, sometimes even they can be very scary, can be even deadly. So that's when we call them diverticulitis.
And diverticulitis, the itis would mean inflammation. The osis just means sort of morbid condition. Well, if somebody has diverticulosis, what kind of diet do you give them?
So there's a lot of old data and old say that people cannot eat popcorns, corns, and seeds, and that is not true.
So it's not true.
It is not true.
As far as diverticulosis and diverticulitis goes.
Sure. People can eat them. This is all pretty much myth, and it's gone.
So what do you do to help the diverticulosis not go into itis?
So we ask patients to avoid constipation, to drop the pressure on the colon wall. That's what we try to do. So we asked him to do a high fiber diet. Fiber has been proven to prevent the itis, the diverticulitis sometimes, and even prevent bleeding from those air pockets.
Wow, so fiber is important.
Yeah.
How do you know, we're reading labels better on food, and it tells us how much fiber is there. What kind of fiber do you recommend a patient use? Because there are some GI recommended ones, FiberMed, and so what do you like, John?
So when we speak about fiber supplements, there's a soluble fiber and insoluble fiber. For people with diverticulosis and they have no other problems, I like something soluble, maybe something like Benefiber, which is a wheat dextrin, or maybe something like psyllium, like Metamucil. They can still do something insoluble like Citrosil.
So do you have to take those every day? Do you take them twice a day? Those are the ones that are sort of over the counter. If you get those, how often do you know how to take them? And can you overdose on fiber?
You could overdose, but
you
could do anything. But usually it doesn't happen. I usually ask them to do a half a tablespoon and then go up on how much they can take a day, because it makes them gassy. And they have to drink plenty of water with it. I asked them to aim for 8 glasses of water a day.
8 glasses of water. Now, do you like water? There's water in almost every food and stuff. Just good old, I call it aqua pura, pure water.
Absolutely.
So that gives you hydration. And the fiber, does it like the water to make it bulky so the GI tract works better?
So there's two forms of fiber. You have the soluble fiber, and it's like dropping an oat in a water, so it gets expanded. And there's stuff that doesn't really get expanded as much, like if you drop a piece of celery. So, as you said, the stuff that goes gelatinous, they're better. They give you that bulk, and they travel throughout the gut. The bacteria likes them, they break them, they eat off them. It's good stuff.
Good stuff. So it helps regulate the gassy, crampy pain sometime. If you try things and somebody comes back and says, my belly's still bothering me, where do we go then?
Well, sometimes the fiber can give them gas. So sometimes we have to kind of go back on gas a little bit. But if people have gas or bloating or just a big belly and they feel gassy all the time, I sometimes ask them, I go into the history and I see some people swallow a lot of gas if they chew gum.
What do you call that if they swallow gases? It's got some fancy long names?
Yeah, it's called aerophagia.
So aerophagia, they swallow air and they burp up, and they have to burp it up. Make them nauseated, bloats the belly.
Sure.
So what do you do for those?
So we asked them to eat and drink slow, small meals, avoid all the artificial sweeteners because they produce gas. Sometimes we ask them to keep a food diary and see what food has caused more symptoms. And sometimes we even put them on a fancy diet and ask them to avoid few things every couple of weeks and so.
So do you have ways to guide a patient to that good diet?
Sure. A lot of work being done on a Fodmaps diet now.
Now what is a Fodmap? Fodmap diet?
Fodmaps, in Fodmaps.
Wow.
It's a fancy name for basically all what bloats you up. It's fermented oligo, di, and monosaccharides and polys. And basically they're short chain, they're small carbohydrates. They're very hard to break throughout the small intestines. Even in us, even in normal people, they're hard to break. But when they cause gas, people perceive it as pain.
So give me an example of what they should take then on a FODMAP, one word, diet. Is there certain foods that you eat that make you less gassy and crampy? Because I hear people all the time saying they're gassy and crampy.
So there's two nice charts. It's like a traffic light. There's a green chart and then a red chart. And we usually ask them to eat off the green chart and avoid the red chart. Red chart would be something like milk and some dairy products. They can still do some hard cheese. They can still do some yogurt. Some fruits produce more gas. Some sugar, alcohol cause there's a lot of bad carbohydrates.
So a lot of times the patient needs to rely on the physician's knowledge and guidance in order to have a good belly. John Altawil, you are absolutely a great physician and have given us and the Dr. Bob Show great information. Thank you so much for coming, and I hope you'll come back.
Dr. Bob, it's a privilege and it's an honor to be here.
Thank you so much.
Thank you so much.
You are what you eat, so remember that, and be sure that you follow Dr. Altawil's advice and recommendations. And you'll want to stay tuned. We're going to be talking about now, what does a heart attack feel like? And Doc, I got a bad knee. What can I do? Depends on how old you are, maybe. We'll talk about it. A lot of information. I want to thank Dr. John Altawil. Wonderful discussion on when your belly goes bad, what to do for it. And now questions from you, the viewer, that I think will be important to your health. Dr. Bob, question number 1. What does a heart attack really feel like? Well, that's a good question, because sometimes they're different between men and women. Men and women are different, and their hearts are different. In women, there are small vessels that go down on the inner part of the heart muscle, not in addition to the coronary artery. So they may have sweating and feel faint and feel like they've got back pain and uncomfortable and short of breath, but they know something's going on. Whereas men might have the typical squeezing, crushing, pressure pain right in the middle of the chest that may radiate up into the jaw, may go down the inside of the arm. If there's angina, that's a sort of mini pre-heart attack. That's with exercise. You get crushing chest pain, may go up the neck, down the arm, relieved by rest. A heart attack, you break out in a sweat, you've got crushing pain, you get short of breath, you break out in a sweat. That's take an aspirin and 911. You must get to the emergency room quickly. If you can diagnose your own heart attack quickly, then the doctors in the emergency room can immediately open up a blood vessel that has clotted off and will open that up, and just maybe you won't have any damage to the heart. Crushing chest pain going up into the jaw, down the arm. Think of heart attack, call 911. Now, question from you, the viewer, again. Question number 2. Doc, my knees are bad. I'm too young for a replacement. Well, the good news is the old replacements, a long time ago, they used to just last 15 years. Now they pretty much last indefinitely, and they are so good. Usually, people will say, I wish I'd have done this earlier. But let's talk about the young knee that's creaking and crackling and crunching, and it hurts and it swells up at the end of the day. We need to really work on our quadriceps muscles. Those are the thigh muscles. So we can just sit on a table like this and put something, weight on our ankles, and just work the muscle of the thigh. The more you work that, the stronger that joint will be. Sometimes you may need an injection that will take away the inflammation in the knee. If the knee swells, it will keep the knee from bending all the way. As that progresses, you'll have difficulty walking down a hill. It's much more difficult when you're hiking to walk down a hill. When you walk up, it seems to be better on the knee. When you get out of bed and you really can't walk for a while, it's getting hard and everything goes like Rice Krispies, snap, crackle, and pop. You need to be sure you see the doctor, be sure that you're taking the right medication. Sometimes it can simply be that all you need is a non-steroidal anti-inflammatory medicine, such as aspirin, ibuprofen, whatever your doctor recommends. Remember, there's no free lunch on medications. So all the medications we mentioned will possibly have side effects. Usually they're bothering your stomach. Sometimes we can break out in a rash. Sometimes we can have an allergic reaction. So no free lunch when you take a medicine, when you pick out a medicine that you want to take for your knee. then you be sure that you work that out with your doctor and let your doctor know you're taking those medications. Too often we don't give the doctors a chance because we're taking over-the-counter medicines, which are good, but you have to be sure they don't interact with anything. So good luck on those knees. Eventually you'll know, and the knee doctors say, when you come in and say, I just can't stand it anymore, we've got to do something, it may be that that's the time for a knee replacement. All the time that we have for this show, remember, we like to exercise. We need to exercise regular. It will help develop new vessels around the heart, so you'll have less chances of having that heart attack. Exercise will help strengthen the joints. We need to get 7.5 hours sleep. Know that when you sleep better, you'll feel better. Know that your eating habits, like Dr. Altawil talked about, good eating habits will make your belly good and will make your body good. And most of all, what is it that we like in the Dr. Bob Show? Well, it's that laughter in your life. Remember, when you laugh and when you giggle, it helps your immune system. People that laugh a lot have less upper respiratory infections. They feel better. The people around them feel better. Life is better just by being happy. So laugh a lot, enjoy life, and you'll stay healthy.